You may not know this, but there's a good chance you could be deficient in some crucial vitamins that help to fight cancer. Now, I'm not here to push supplements on anyone, but after cancer, your body needs a little extra help. And this isn't just about feeling better, it's about keeping your cancer from coming back. I'm Sarah from Remission Support, and my mission is simple. It's to help you beat cancer or stay in remission by making the best diet, lifestyle, and supplement choices. That's why I'm here, and that's why I started this channel. So if you haven't already, please subscribe so that YouTube will show these videos to more people who can benefit from them as well. In this video, I'll be giving you the lowdown on the most important vitamins for you to be focusing on and how to know if you're deficient in them. If you've been feeling tired, low on energy, or find yourself catching colds more than you used to, these could very well be signs that you're not getting enough essential nutrients. It's said that over 70% of all cancer survivors are deficient in at least one, if not all, of the vitamins I'll be talking about today. The last one I have for you isn't a vitamin, but it's a supplement that you likely haven't heard of before, but it's now being considered a miracle supplement as more and more research is emerging on the benefits for cancer prevention and treatment, especially for some forms of breast cancer. Now, you've likely heard me say this before, but one of the best things you can do after cancer is to support your immune system. You see, your immune system is your body's main defense against cancer cells. A healthy immune system has an easier time recognizing and destroying precancerous cells before they turn into cancer. And the easiest way to ensure your immune system is functioning well is by getting the vitamins and nutrients it needs. But amongst all of them, there are a few that really stand out. Here's the thing, cancer treatments are harsh and can leave you deficient in vitamins like iron or magnesium, for example. But the good news is that these deficiencies are often easy to fix with the right foods or supplements. The easiest way to know if you're deficient in something is to ask your doctor to do a blood test. This way you'll know which supplements you may need to be taking, and you won't be wasting your money on those you may not need. But I must say that some doctors aren't keen on doing extra tests because they think it's unnecessary or too expensive or not covered by your insurance. But don't let that discourage you. I think it's crazy that testing for things like vitamin D levels isn't part of a routine lab test, considering it's one of the most important vitamins after cancer. But there's also a lot of controversy over taking supplements. Some people think they're a waste of money because you should be able to get what you need from eating food alone. But the thing is that most people don't eat enough of the right foods to get the recommended amount of, say, calcium or iron that they need. So let's go over the most important supplements for you to be taking and why. Starting with vitamin D, this one is huge. It's estimated that over 1 billion people worldwide don't get enough of vitamin D. But why is it so crucial? Well, there are at least 3 ways that vitamin D can help you fight cancer. Number 1, it regulates cell growth. Vitamin D helps your cells grow normally, reducing the risk of them turning cancerous, and it can slow the progression of existing cancers. Secondly, it reduces inflammation. Chronic inflammation is a big risk factor for cancer, so vitamin D's anti-inflammatory properties are essential. Thirdly, it strengthens your immune system, which we know is key for identifying and destroying cancerous or precancerous cells. So now that you know how important vitamin D is, it's also important to know that certain health conditions can reduce your body's ability to absorb or use vitamin D properly, like obesity, kidney disease, or GI conditions like Crohn's disease or ulcerative colitis. But a vitamin D deficiency is really hard to diagnose because some people feel fatigue, muscle weakness, or bone pain, but others have no symptoms at all. So here's a few ways you can make sure you're getting enough vitamin D. You can get more sun, safely of course, with sunscreen. You can eat more foods that are rich in vitamin D, like tuna, salmon, liver, eggs, or mushrooms. But honestly, even these may not provide you with sufficient amounts. So after cancer, it's often just best to take a vitamin D supplement. Most multivitamins will contain vitamin D, but just be sure that it's the right form. You want to be taking vitamin D3, which is the active form, not vitamin D2. And you need at least 600 to 800 IUs, international units, per day. Next up is vitamin C. This is the ultimate antioxidant and immune system booster that you need after cancer treatment. It can be so powerful that your doctor may have told you to stop taking vitamin C supplements while you were going through treatment because high doses of it can actually interfere with treatments like chemo or hormone therapy. But please know that it is still safe while you're on treatment to be eating foods that are high in vitamin C, like citrus fruits, berries, tomatoes, and spinach. And if you're not eating these foods regularly after you finish treatment, again, make sure it's in your multivitamin, at least 90 milligrams a day for men and 75 milligrams for women. While it hasn't been proven yet to cure cancer on its own, some doctors have been using high-dose IV drip vitamin C to boost the effectiveness of cancer treatments and reduce treatment side effects. Pretty amazing, right? Similar to vitamin C, another important antioxidant after cancer is vitamin A. Studies have shown that eating higher amounts of it can actually lower your risk of getting certain types of cancer like cervical, lung, and bladder cancer. Something else that's really interesting is that if you developed eczema or other skin issues after cancer treatment, especially chemo or radiation, low vitamin A levels may be to blame. Or if you have a wound that's taking a long time to heal after surgery, it can also be due to low vitamin A levels. This is because vitamin A promotes the creation of collagen in your skin, so taking a vitamin A supplement or using a vitamin A cream may fix your dry skin issues and help wounds to heal faster. There is one deficiency that your doctor will likely test you for after cancer, and that is iron. This is because a lot of patients going through treatment have low red blood cell counts, a condition called anemia. And one cause of anemia is an iron deficiency. As a vegetarian, I've had anemia a few times in my life, and I can always tell when my red blood cells are low because I often feel weak, tired, and get cold really easily, even in the summer. But not all multivitamins contain iron, so try to find one that does. Men need 8 milligrams a day, while women actually need 18 milligrams a day. But iron supplements can be a bit tricky because they can create side effects in some people, so again, please check with your doctor first. But I've corrected my anemia just by eating more foods that are high in iron, like white beans, lentils, spinach, or tofu, for example. Oh, and good news, dark chocolate is also high in iron. Another important thing to know is that your body will absorb more iron when it's combined with vitamin C. And you should avoid drinking coffee or tea with iron-rich meals because the tannins in them can also affect how your body absorbs iron. And finally, the supplement that you likely haven't heard of before that is making some major headlines in the world of cancer research is called MSM. This is most used as an anti-inflammatory for conditions like arthritis, but more recently, scientists have been proving that it can also help prevent cancer. There are only very small amounts of MSM in certain foods like fruits, vegetables, or grains, so you would have to take an MSM supplement to get the full benefits from it. A couple of promising new studies have even shown that MSM can slow the spread of certain types of cancer and promote cancer cell death. For example, a study in the International Journal of Oncology showed that MSM inhibits the HER2 gene expression in breast cancer cells. And another study showed that MSM can improve the way chemo drugs affect endometrial cancer cells. All very promising research. Obviously, we've known for years that vitamins have several health benefits, but now researchers are realizing that we need to be exploring how high doses of vitamins may have the ability to treat illnesses like cancer. For example, a decade ago, scientists noticed that people who live in sunnier parts of the world had lower rates of cancer than people who live in areas with less sun. So they started studying the effects of vitamin D, and lo and behold, found that a deficiency in it is associated with a variety of cancers like prostate, colorectal, and breast cancer. So now they're actually doing clinical trials on this, and one has already shown promise that high doses of vitamin D3 can extend the life expectancy for people with colon cancer on chemotherapy. And this is just the beginning. This is really exciting. But since none of these studies have confirmed anything yet, the best thing you can do for now is to ensure you're taking a multivitamin that includes, at a minimum, all the vitamins I've been talking about today. These aren't the only vitamins and nutrients that are essential after cancer, but for the sake of keeping this video short and sweet as usual, I'll be creating a part 2 on this very soon, so stay tuned and stay healthy. Bye for now.